Hello, welcome to this session on Introduction to Policy Analysis, in which we talk about policy analysis as being one of the different methods that we use within the SHAP Fellowship Program. This will be a quick video in which we'll try to cover very broadly two main points, which is what is meant by policies and policy analysis and why to do policy analysis. And hopefully, once you get interested enough, then we come to the next question, which is how do we analyze policies? What does the policymaking process look like? And if you're interested in exploring these ideas further, there are links to further readings and resources. First, very quickly, what do we mean by policy analysis? So maybe a better way to understand this, to answer this question is first to figure out what do we understand by the word policy. Policy is a very loosely interpreted term which different people think of in different ways. So maybe what we can do is we can walk through a couple of documents, exemplar documents, to see if it strikes a bell with you. And this could be a policy document based upon your understanding. So this is a 2010 report released by Michael Marmot and his team, also called the Marmot Review, in which they talk about health inequalities and the devastating impacts of inequalities have on public health outcomes and social outcomes. This is a report which is produced by a think tank. As far as I know, there was no formal involvement of a government agency in this. So it's not really a government or a formal official document. It does, however, despite being an academic report, it has been quite influential and has influenced lots of governments and decision making at the local government level in the UK, also internationally among different national governments on how they look at health and inequalities. So do you think this can be called a policy document? Or what about the other document? This is a press release from UK Health Security Agency released quite recently, in which they urge all international travelers to make sure that their vaccinations are up to date. So this is a formal government, UK government body. However, this is not even advice. This is more like a suggestion. It has no enforcement power whatsoever. So do you think this could be a policy document? Or what about going away from national governments, looking at an international agency such as the WHO and its model list of essential medicines? WHO periodically updates its model list, and even though none of the member states are obligated to follow this model list, nonetheless, this list has been really influential in helping ensure that primary health centers across different countries don't maintain an adequate stock of essential medicines at an affordable rate for individuals in the community. So again, nobody is obligated to follow this list, but it has had lots of impact. So do you think this qualifies as a policy document? Finally, right now the US presidential elections are ongoing in the US, and even though the president is from the Democratic Party, but if you look at the campaign manifesto or the policy stance of the Republican Party, even though it does not have any teeth for it to be enforced or implemented, nonetheless, just by releasing this document, it has managed to influence the kind of choices governments, federal and local governments in the US are making right now and will be making in the near future. So, is this a formal document? Is this a policy document? And what do we mean by those terms? Policies are best understood as broad statements of intent, in which public authorities or even other stakeholders, they might provide framework for decision making, or they might say this decision needs to be made or can be made. It can involve different levels of formality or legal legitimacy. It could be a legislation, it could be an act of parliament, it could be a guideline, it could be a technical report, it could just be a press release or a block statement, all of which, if it's contributed to the policy discourse, can be said to be a policy document. And these are the kind of documents that we tend to analyze when we do policy analysis. Why do we want to do policy analysis? First of all, it's really important to do policy analysis to figure out retrospectively, why the decisions got made the way they were made, how, who influenced what, and how did particular item got on the agenda, what was the level of implementation, and how well the policy was implemented. So those kind of questions we try to answer. Policy analysis can also help prospectively design better policies. This could be through the anticipating the effects of implementing a policy, doing stakeholder analysis, and figuring out which kind of interests or individuals need to be lobbied or advocated to help come up with a more realistic and a feasible policy. Which brings us to the next question: how is policy analysis done? Again, to answer this question, it might be helpful to figure out what do we mean by the policy making process and how do we study it. What it might look like to different people. Different disciplines tend to have different ways of understanding policy making. For example, if you are a political science, come from a political science discipline, we might be more interested in how much power agency different individuals exercise, and how do they and what is the dynamics between different individuals and actors, and how does that influence the policy making process. If you are a public administration or a governance scholar, you might be more interested in incrementalism, for example, the institutional dynamics and relationships, and the way even the intent of the policy document, how does that get filtered out through different levels of implementation by different levels of policy implementers. Sociologists or anthropologists who are more interested in unpacking this whole process of policy, policy making, then even a single policy document or a policy proclamation or a policy implementation, instead of looking at it from a technical discrete lens, it becomes a much more diffuse way of understanding how people look at knowledge and how those different understandings influence what gets implemented and who gets affected and what level and how. Obviously, this covers a lot of different grounds. It covers a lot of different aspects of policymaking processes. So we use frameworks or models to help simplify these complicated realities, these complex set of interactions, to help us focus on some key bits which we think are important in the policymaking process. Different frameworks are better suited for different disciplinary perspectives, for different questions, but broadly speaking, they all tend to more or less agree that it's difficult to divorce politics from policymaking process. Policymaking itself is a very messy, non-linear process in which lots of different individuals involved with different levels of interest, different levels of powers and influence, and different levels of understanding, and how all of them interact with each other in order to develop policies. And policies themselves, need not be individual discrete decisions or documents. It could be a much more wider set of activities and thoughts and ideas. I'll give you a very quick flavor about two different frameworks that are used for policy analysis. One is a relatively simple stages heuristic model. You have three different stages of policy making. Before deciding, you have agenda setting, policy formulation. Then you actually implement the policy. Then you adapt the policies. Then you implement the policy and then evaluate it, change it again, and then it goes in the cycle again. Obviously, it's a very simplified, very simplistic way of understanding the supposedly non-linear way of policy making, but it can be very useful when you're in some context. A second example of a policy analysis framework is the punctuated equilibrium model, which we got from the biological and the evolutionary disciplines, in which they say that policy changes tend to take place incrementally for long periods of time, but sometimes in compressed periods, there's some window of opportunity in which there's a potential for increased appetite for risk-taking, for changing, in which policy entrepreneurs are able to make use of this opportunity and present their versions of solutions or policies. Lots of changes get made in narrow windows of time. So that's why it's called equilibrium, punctuated by small increments of rapid changes, which is actually pretty good model for lots of health emergencies, disease outbreaks, etc. to study. So I know this is a very rapid whistle-stop tour through policy analysis, but if you are interested in learning more, then these are some good resources to get started on figuring out how to do policy analysis. If you have any questions about, accessing these readings or figuring out how you want to discuss policy analysis within your own institution, feel free to get in touch with SHAP at the following address. I hope you found this useful. Thanks very much.